10, maybe 5 minutes. So. Hello, everyone. My name is Amanda Ortman. I am the Director of Audiology Studies at Washington University School of Medicine, and I am presenting this poster on behalf of our team, Casey Reimer, who is the Interim Director of Deaf Education Studies, and Heather Grantham, who is now the Executive Director of Central Institute for the Deaf. So we are from the program in Audiology and Communication Sciences here at Washington University, and we train students for preparation for careers in audiology and then also in deaf education. So we offer the clinical AUD, Clinical Doctorate of Audiology degree, and the Masters of Science in Deaf Education. So I want to talk to you all about interprofessional training of future teachers in our program. We know that these professions are not, do not operate in silos when we think about providing services for children who are deaf or hard of hearing. There is oftentimes an enormous interprofessional team that is working on behalf of that child. And this can include teachers of the deaf, audiologist, speech language pathologist, occupational therapist, early interventionist, and many more. And so we do believe strongly that we need to train our teachers and audiologists as well to have interprofessional skills and to be able to talk to one another and to realize that they need to see the bigger picture and not just operate in one aspect, especially when we think about making this child-centered care and education. So the background here, so interprofessional education refers to teaching students on how to learn from each other, how to work with each other, and how to deliver that patient-centered or child-centered care. So this is interprofessional education has become sort of a buzzword in schools these days. And, you know, it's all about trying to have IPE activities. And I think there are some IPE activities that are very good. And then some are just more of, let's just learn what each other does. But we wanted to take a different approach with IPE activities. And we wanted to really get them learning together, not only in the classroom, but also hands-on activities. And so just to create a strong bond with the cohort and to realize what is going to happen in the real world when you have the clinical or educational based scenarios. So we, again, we are training teachers of the deaf, and specifically teachers who are going to be teaching children who are deaf or hard of hearing who use listening and spoken language, and then also audiologists as well, who will be oftentimes working in either the educational setting or the medical setting to improve hearing access of these children. And so teachers of the deaf need to have a knowledge that is very common with audiology, which is basically, you know, hearing technology and acoustic science and all of those things, so that they have a better understanding of how to serve children who wear these devices and how to troubleshoot. And audiologists, on the other hand, need to understand typical language development, school systems, how IDEA works, and also early intervention systems, and also counseling techniques. And so I think it's very important. There's a lot of overlap between these two professions when we are thinking about child-centered care. So we have coursework that overlaps between audiologists who are wanting to be pediatric audiologists. So they have self-identified as wanting to go into the field focusing on the pediatric population, and teachers of the deaf. So they have overlapping coursework, but in addition to that, they have overlapping hands-on activities. And we are very lucky that we have such a strong partnership with Central Institute for the Deaf, which is a school that serve children who are deaf or hard of hearing in listening and spoken language, as well as the MOOC Center for Deaf Education, which is also a school that focuses on listening and spoken language. Both of these schools are right here in the St. Louis area. So we are very fortunate to have access to the patient population or the educational population that we are trying to serve. And so we have partnered with them in training these students. And so we have developed hands-on activities where we rotate small groups of students through the clinic at these schools. So it's an educational audiology environment. And so we walk through stations that are focused on hearing aid troubleshooting, cochlear implant mapping, um, behavioral audiometric techniques that include condition play audiometry and then behavior observation or visual reinforcement audiometry. That was a lot for me to say. And so because oftentimes the teachers may be pulled in to help assist with educational audiologists and testing because the teachers know the kids the best. And the kids are with the teachers every day and they're with the audiologists periodically. And so oftentimes it is really nice for the teachers and the audiologists to partner in testing because the teachers are going to know a lot about the language abilities of the kids and the behavioral modification techniques that is necessary for that child. And so it is really nice to be able to train these students together so that they have a skill set that they can take with them into their career. And so these four workshops that we host, we buy out the time from the clinics, from the MOOC Center and Central Institute for the Deaf so that we can kind of take over their space and send our students into their space. And then we recruit families and children who are deaf or hard of hearing who will serve as volunteers so that the students can practice testing technique, hearing aid troubleshooting, taking that hearing aid in and out of a child's ear. Because I think so oftentimes these students are scared to touch, put that hearing aid in the ear because it's always daunting the first time you have to do that for someone because you have to think, okay, my right, your left, I'm going backwards, and it's a very unique experience. But then once you are a professional, you get the hang of it and you can just stick that hearing aid in without a problem. So this is just a great experience for these students to learn together and to learn what each profession does and how they can help each other and how they can communicate with each other. And the students, exchange cell phone numbers so that they always have a resource and a future peer and collaborator in their career. And they just understand that the audiologists, the teachers understand that the audiologists are not the people who live over here and the teachers live over here. They work together. They are in the same space together. They may not physically be in the same space, but they're always a text, FaceTime, email, phone call away. And I think that's very important. We get fantastic feedback from the students, from the educators and the audiologists. They really do love working together and they see the value in this. And so we put a sample of feedback that was given from some of our students on this poster that you can read through. But in conclusion, interprofessional activities are so important and so valuable for training of future professionals. And we really need to have this included in all educational activities. And we do argue that it should be a combination, or it's especially valuable if it's a combination of coursework and hands-on activities to get those students talking with one another and understanding what they need to do for their career. So again, it has to be authentic, it has to be real, and it's not just about putting them in the same room, it's getting them to work on a task together. That is interprofessional education. I think sometimes we focus so much on just getting them side by side, but really it's getting them to focus on a task together, which in this case is focusing on the care of a child. And that's it. If you have any questions, feel free to email us, reach out to us. We're happy to talk to you and entertain any questions or comments that you have. And I think that concludes it. And I will stop my share and stop my recording.